I actually gave a talk at the plenary session on immunotherapy, and it was honestly, this is an interesting and exciting meeting to hear about what's going on, not just in immunotherapy, but really on the genomics of this of cancer in children. I think it's something that is of great importance because it is the kind of cancer that's neglected, not because people don't care, but just is not getting the kind of awareness that it really should. We have been looking at antibody for 30 years, and we've done a lot of work with getting drugs to the patient. We make a lot of antibodies, and I think that we really make a difference in terms of the long-term outcome. And we are beginning to see our children now growing into adults. They're getting married, they're having children, and I'm excited about it. But not everyone is that lucky. There are still quite a few patients who never get cured, and that's really where we want to take the next leap forward, and that is really looking at T cells. These are the cells that we haven't been using in the past, and these are the cells that are really powerful professional killer cells that we really want to take advantage of. And this is how we build these bispecific antibodies that now can attach, or essentially like handcuff the T cell to the tumor and let them fight it out. And of course, you know who's going to win, the T cells. Well, the GD2 is a target that it is really abundant on tumor cells. And this has been the target we've been going after all these years. Now, when I mentioned the handcuff, essentially the handcuff is go on one end to the GD2, and the other end is to the CD3, which is on T cells, and then you get them together. Well, that's another thing. We are building another kind of bispecific antibody, where one end is GD2, again, hooking to the tumor, and the other end is actually bringing in a small little ligand called DOTA. And what this thing does is it carries with it a radioisotope. It could be an alpha emitter, like an atomic bomb, or a beta emitter, like what we use for thyroid cancers, for example. So we now have this ability to bring isotopes, in fact, to use a good use of isotopes to treat patients, something that Madame Curie has dreamed many years ago. And now we're just beginning to actually able to use it, and not so much at external beam radiation, but as a liquid radiation, which I think is be a really interesting approach. Well, that's something particularly important in children, because we not just keep them alive for a few years, we want to keep them alive for the next 100 years. And if we cannot keep them alive and making every single organ function the normal way, it will be a problem. So late toxicity has always been an issue. Any of the treatments that we give, we always have to look at the long term, whether this is T cells or a radioisotope. We need to be sure that the method that we use is not going to damage any of the vital organs. And I think we're making a lot of progress. We are able to identify, what are the risk factors certain patients may have. How can we cut back the innocent bystander damage? And I think we're getting much better now these days and reducing those late effects. Well, I think that this is the era where I'm as excited as I was 30 years ago, and I think I'm even more excited because of all the possibilities. Now, there are many still hurdles in trying to get drugs to the people, to the patients, to the children, but I think it will take some work, and I think that if there's a will, there's a way.